Assalamu alaikum wa rahmatullahi wa barakatuhu, and a very good afternoon to all of you. Ladies and gentlemen, this is Srinagar Jung and Onlykashmir, and we are going to have a very important and candid interaction with one of the greatest personalities of India, who has achieved a lot in the medical field and hence contributed to the health sector of the country. That is none other than Dr. Swapna Mishra. She is the Director, Department of Gynaecology and Obstetrics, Fortis, Mohali. Welcome, ma'am, and thank you so much for giving us your important and precious time and believing in us so that we can interact with you on the very important topic that is related to women, but it pertains to the entire society. Ma'am, we know that among teenagers across the globe, particularly in Kashmir, we have seen that PCOS, polycystic ovarian syndrome, is increasing, rapidly and exponentially. Can you tell us what are the reasons and how can we get rid of this disease? It's kind of a monster, and people are so much scared that the woman cannot get married, or we must not, have a greater interaction regarding this, because it is considered to be very ugly, honestly speaking. So can you please throw some light on it?
Yeah, PCOD is basically a genetic cum environmental disease. 30 to 40% of the girls are born with PCOS, but not everyone has a disease. Why the disease is happening? We are not controlling the kitchen of the house. The girls are not told to exercise. We are not checking what they are eating. The junk food is rising day by day. The fatty food is rising day by day. The artificial food is rising day by day. Addition of sweets is adding day by day. Are we checking the weight of young girls? They are small, eat whatever. Why? Are we checking what amount of food and what quantity and what quality of food they should eat? Till we are not controlling what the diet of a family is happening. I'm not saying for the girl, the whole of the family, the father, the mother, the brother, the sister. If everyone's diet is taken in control, and this woman who conceives with a healthy diet, she won't give birth to a girl with PCOS, and this girl, if she grows up with healthy eating and with a inculcation of exercise in her routine, maybe she goes out to play, maybe she goes for running, maybe the parents are also pushing the family for a regular exercise, I don't think the girls will land up with PCOS, or at least they can postpone the symptoms for many, many years.
There's a fear that PCOS hinders pregnancy or conception. Is that true?
PCOS women who exercise and are having regular periods will not have any problem with conception. It's only when you start gaining weight, when you do not exercise, when you are not checking your BMI, that is the time you will have infertility and other issues.
Ma'am, is PCOS curable?
Definitely.
Okay. So that's a great news for girls, at least, that it is curable.
Definitely it is curable. Get your diet modified, go on a high protein, low carb diet, stay away from the junk food, stay away from the fried food, and start exercising for at least 1 hour daily, 5 days a week, and you will not have PCOS.
So say no to sedentary lifestyle. Definitely. And yes to an active lifestyle.
Definitely.
Ma'am, let's talk about hypertension. Has PCOS something to do with hypertension?
PCOS will not cause hypertension, but any weight gain will cause hypertension.
Okay, and so that will lead to PCOS? Is it like that?
No, weight gain will not cause PCOS, but PCOS causing hormonal disturbance can cause weight gain. Okay. So again, check your weight, do exercise daily, stop eating junk food, take care of your calorie intake, and you will not have PCOS, you will not have weight gain, and so you will not have hypertension.
Okay, ma'am. So let us talk about robotic surgery. It's an emerging field and it has a great promise. So what is it all about and how can it benefit us?
This is called as generation neck surgery or a future surgery. I have been doing robotics since 2017. We've done more than 500 robotic surgeries.
Wonderful.
Basically, it is a surgery meant for saving organ. What happens, a girl has a cyst in the ovary, huge cyst, she goes to the doctor, she says, get the ovary removed. She has got fibroid, maybe she's married, maybe she's single, maybe she's planning to get married, and doctor says, sorry, you can't have a child, either live with the fibroid or get your uterus removed. Okay. Here we come and our role comes. We remove the cyst, do not remove the ovary. We remove the fibroid, we save the uterus. We want you to have a normal life, but without giving you a cut. We give you 4 holes. In 4 holes, we do the entire surgery because we are trained for that, we are expert for that. 24 hours post-surgery, you go back home. 48 hours post-surgery, you can do whatever. 7 days post surgery, you can go back to your job, your school, your college. So this is what
After
robotics is.
robotic surgery is being performed on a patient, can that woman conceive?
Definitely. So that's
Will
the
it be a
reason.
normal pregnancy or a high risk pregnancy?
Definitely a normal pregnancy. We are removing the disease. Once the disease is gone, the pregnancy doesn't become a high risk, it becomes a normal
So
pregnancy.
can there be a normal labor and normal delivery?
If she has got an ovarian cyst, definitely she can have a normal delivery and labor. If she has got a fibroid which is on the outer wall of the uterus, yes, she can have a normal delivery and labor. If only she has got a fibroid which is going all through the wall of the uterus and multiple stitches have been taken in the uterus, she has to undergo a cesarean section. But yes, she can conceive.
Okay. How safe is robotic surgery?
100%. We have not had complication as of now, touch wood, in any of our patients. None of our patients needed blood transfusion. None of our patients needed hospitalization beyond 48 hours. None of our patients needed antibiotic. So I'll say it is really a very safe
Does
surgery.
robotic surgery take place in the valley?
It doesn't take place in the valley because the machine is 16 crore.
Okay.
So not every hospital, I would request the government here to think of bringing robotic program here in the valley. But till that time, if you can afford, come to Fortis Mohali, I can do it. Cannot afford, AIMS Delhi has got robotic surgery.
How
So you
can
could
people
come.
reach you if they want to contact you or interact with
I have a number. I am very active on my social media. I've
With
got
the
a
name?
WhatsApp, with the name of Dr. Swapna Misra. I am there on my Instagram. I'm there on my Facebook. I have got the same. I've got a WhatsApp number which is there on my Instagram. You can reach out to me. I am working at Fortis Mohali, director and gynae. So infertility, we have to first find out the reason for infertility. Is it there are 70% causes in the female, but 30% causes in the
or
male.
in the male?
So we
But
have
they
to
don't want
investigate.
themselves to be,
So
checked
we have
or
to take
monitored.
that part out. So till the male and women have to be examined at the same time for infertility. Both have to be treated. You have to find the reason for infertility and it is treatable. What I'll say is that with the latest technologies which are available, with self-trial, with follicular monitoring, with IUI, with IVF, it is not possible for a woman to remain infertile. It is not possible. Within 1 year of the first time diagnosis of infertility, any woman, whether it's a male factor or whether it's a female factor, can conceive.
What about IVF? How safe is it?
Absolutely safe. There is no side effect of IVF. It's absolutely safe.
Okay, so what is your message for the society and for women or females in particular?
My message to the society is that first, why to have the disease? I'll come once the disease has happened. Don't get the disease in your house. Control the kitchen of your house. Send your girls out for exercising. Check their weight. Do not get junk food for your kids. If you start doing this, I don't think your kids will need me for surgery.
Thank you so much, Dr. Swapna Mishra. And this is Sabahat Nazir signing off. But I have a very important message to all the girls out there. Please take care of your menstrual hygiene because that forms the foundation of your life. Not only your reproductive life, but your entire lifestyle. Your entire life revolves around menstruation. Thank you so much.